Welcome to my channel. My name is Tammy and I'm a retired registered nurse who worked in public health for many years. And I myself started to go through perimenopause and I was absolutely struggling. I started having symptoms around the age of 45. I'm now 50, about to turn 51 in August. And I am on the hormone journey. And I wanted to share my experience with all of you because this is just not something that us ladies talk about. So today I want to talk about estrogen specifically. I started a estradiol patch about 3 weeks ago, and I really want to share my experience and my knowledge with you around the notion of estrogen. Why is it prescribed? How is it prescribed? What are the risks? What might be some of the benefits and so on? So I just want to talk about that a little bit today. So estrogen itself was first isolated and identified in like the late 20s and 30s. And the first form of estrogen that was used as a form of medication was first created by extracting estrogen from the urine of pregnant women. Oof. Anyway, apparently it was found to be a very rich source of the hormone. They used this extract initially, this crude sort of extract, to treat menopausal symptoms with people who may have had an estrogen deficiency. And then in the 1940s and 50s, the first synthetic forms of estrogen were developed and they were brought in to the markets, a form called DES, which I'm not going to try to pronounce that word. You're just going to have to look it up. But these synthetic estrogens were found to be more potent and longer lasting than the natural estrogens found in urine. In the early years of estrogen therapy, these medications were primarily prescribed to treat symptoms of menopause, not perimenopause, not early menopause. However, over time, we started seeing the use of estrogen expanded to include a wider range of treatments and conditions. It includes treatments for things like osteoporosis and other hormonal imbalances that can occur because of our hormones kind of going out of whack during this time in our lives. And obviously, perimenopause is also an expanded scope of practice for the use of estrogen. So you may ask yourself, what are the different versions of estrogen that are used in HRT? And what might I consider for my own use? Well, first of all, let me just say that I am, like, total disclaimer here, I'm not a physician. I'm not even a registered nurse anymore. I'm retired. So this is a conversation between you and your healthcare practitioner. But I will share with you the different forms and what I was told and what I understand around the risks of the various forms and why I chose to go with a patch instead of a pill, for example. So there are basically three main types of estrogen that are currently used in hormone replacement therapy, or HRT. There's estradiol. This is the most common type of estrogen used in HRT, and it's the same type of estrogen that your ovaries produce before menopause. Then there's estriol. This is the type of estrogen that's a bit weaker than estradiol, but it's still very effective in relieving menopausal symptoms. It's often used in combination with estradiol in a lower dose form. And then there's estrone, and this type of estrogen is produced by the body after menopause. It's the weakest form of estrogen and is usually not used in HRT unless the other forms are not enough or not effective, or perhaps there's more risks involved and this lighter version of estrogen might be considered. Now, you may have heard about biosynthetics, the phrasing, and it can be a little scary to think about biosynthetics, like something robotic or something artificial. It is a synthetic hormone that's chemically identical to your estrogen that you would normally produce in the body, whereas natural estrogen refers to the estrogen produced in the ovaries. Biosynthetic is crafted in a lab. Both synthetic and natural estrogen have the exact same sort of chemical structures, and they can bind to the estrogen receptors, the same receptors you have throughout your body as a source of hormone replacement. So that's the main difference between the two. Now, we have estrogen receptors throughout our entire body, so everywhere from our cardiovascular system to our musculoskeletal system. So that's why we have more pain, our blood pressures go up, etc., etc. So there's all sorts of reasons why we need to replace our estrogen at some point during this time frame in our life, or at least consider replacement with our physicians. So the one big advantage of using biosynthetic estrogen is that the composition of it is very consistent, and the effects on the body can more closely be monitored and controlled than with the use of natural estrogens. It also has a lower risk profile to disease processes and decreases the risk profile of the various different side effects that you can have with these drugs. Most recently, the science is sort of demonstrating that the biosynthetics are generally safer overall than original forms of estrogen or natural forms of estrogen. And that's the reason why there seems to be a push towards biosynthetics being used by our healthcare practitioners. So how are they prescribed? How do you get HRT estrogens? Well, they can be delivered in a variety of different forms. The most common form of estrogen that's actually delivered for HRT include the following. So you have oral tablets, and this estrogen can be taken orally in the form of a tablet or a pill every day, and it's swallowed with water. There's the transdermal, which I'm going to talk about in a minute, which is the patches, and this can be delivered through the skin using the patch. The nice thing about this patch is that it can be applied to the skin pretty much on the lower part of the body or the lower abdomen and buttocks. It's replaced every few days, usually every 5 days, but to make it simple, it's usually specific days of the week that you would change these. Then you have transdermal, which is applied through the form of a cream or a gel on your skin and is usually applied in the inner arms or thighs and is absorbed through the skin. You have vaginal creams or tablets where estrogen is delivered directly to the vagina itself using creams or tablets. There's benefits to this as well because a lot of times in perimenopause, most importantly in menopause, we start to lose some of the structure of our vaginal walls. They become thinner and more ready to bleed and get irritated. It can make sexual intercourse really painful. So sometimes the vaginal creams are a good choice. And there's also the use of vaginal rings, which is a flexible ring that contains estrogen that is inserted into the vagina and left in place for a few weeks at a time. Now, obviously, the choice of estrogen delivery for you will depend on a few factors, and it includes your preferences, but more importantly, it includes your medical history and the type and severity of your symptoms that you're experiencing. So some of the more common symptoms of low estrogen, some of the symptoms that I had were things like body aches and pains, so joint pain, a lot more joint pain, muscle pain, fatigue was a big one for me. Vaginal dryness is one that can be a problem. I had dry skin, dry itchy skin. I had dry eyes. I also had tender breasts, and not just before my period, but a lot of times during the course of the month. I didn't exactly have hot flashes in the traditional way. I don't really have those. It's more of I get warm, I throw the blanket off for a few minutes, and then I get really cold and put the blanket back on. The other symptoms I had were things like irregular periods. I started to have either, really short situations where I'd have a menstrual period, and then 2 weeks later I'd have another one, and then 2 weeks later I'd have another one, which was really frustrating. And I thought that was abnormal, but when you're in perimenopause, that's not abnormal. If you're menopausal and you haven't had a period for a year and all of a sudden you start bleeding, that's a concern. That's cancer until proven otherwise. So if you start bleeding after menopause, please go see your doctor immediately and have that checked out. I had headaches often as well and would start getting migraine-like symptoms, like I'd have auras in my vision and things like that. My blood pressure started to creep up as well. As my estrogen started to drop, my blood pressure would go up. So those are just some of the signs and symptoms I had, but do your research on the types of signs and symptoms you can have with estrogen depletion. They're quite vast, they're quite wide, and they can be very different depending on the individual. And by the way, each of these symptoms will inform what forms of estrogen you should be considering. So what are the risks? Well, the risks associated with HRT really vary depending on who you are, your health status, what your background is, the type of estrogen that's being prescribed, the dosage that's being prescribed, how long are you going to be on it, et cetera, et cetera. So there's a number of factors, which is why this is a really important conversation to have with your healthcare provider. There are higher risks associated with certain types of estrogen, and obviously the biosynthetic versions that mimic the body's estrogens have much lower risks associated with them than giving you whole or real estrogen. So for example, oral estrogen replacement therapy has been associated with a higher risk of blood clots. So that's a higher risk compared to transdermal, which is the patch, or transdermal creams or vaginal estrogen replacement. So this is because oral estrogen, when you swallow it, has to be metabolized in your liver, which can cause an increased production of your clotting factors in the blood. So if you have a clotting factor problem already, that will probably negate you from being able to get estrogen. On the other hand, transdermal estrogen and vaginal estrogen replacement have been associated with a lower risk of blood clots, as that estrogen, it bypasses the liver altogether. It doesn't go through your GI tract at all and enters the bloodstream more slowly and at much lower doses. So additionally, a thing to consider is that estrogen replacement therapy that is not combined with progesterone, at least in women who have their uteruses still. So if you are in perimenopause or menopause, you still have your uterus. If you don't combine estrogen with progesterone or progestin, it does apparently increase the risk of potential endometrial cancers. Other kinds of risks may be liver disease, again, because if you're taking the oral form and you're processing it in your liver, it can cause stress on your liver. And again, if you are at risk of blood clotting, then that increases your chances of a heart attack or stroke. Any form you take has its risks, some much lower and some much higher. So it's important to have that conversation with your provider. The other thing is that once you start on these, they can have side effects, and it's important to know what those side effects are so you can kind of keep aware of it. And again, when you start HRT, your provider will give you a document or something, some resource that you can look at to see what kind of side effects you might have. But the common ones are things like breast tenderness, What was really interesting is that my nurse practitioner's office actually informed me, this is something I learned. I did not know this as an RN, which is really interesting. If you have breast tenderness in the front of the breasts, that's estrogen causing that. If you have breast tenderness on the sides of the chest, on the sides of the breast, that's progesterone. So if you have too much progesterone, you're going to have, or if your progesterone is at a higher level than your estrogen, you'll have discomfort in your side breasts. And if it's estrogen is higher than your progesterone, you will have sort of the nipple and areola areas will be more painful. I just found that interesting. I thought I'd share that with you. I had no idea. Using HRT can also cause nausea and vomiting, abdominal cramps, headaches, migraines, mood changes. You can get depressed. It can cause vaginal bleeding or spotting, fluid retention, skin irritation. I feel like I'm one of those commercials, you know.
Lipitor is not for everyone, including people with liver problems and women who are nursing, pregnant, or may become pregnant.
Anyways, it doesn't matter. There's side effects. Do yourself a favor, and whatever you're using, find out what those side effects are and make sure that you're aware so that when you start taking them, you can be familiar with it. So as I told you before, I started Estrodot. Estrodot is estradiol in the transdermal therapeutic mechanism. So it goes on your skin. Obviously, I'm not going to show you how to put this on because it's my butt that it goes on, or my upper thigh.
Look, I'm wearing something similar. See? You can't see the line.
Can't see the line, can you, Russ?
No.
But I will show you the patch itself. So the patch typically comes in a little container like this, estradiol. And when I change it every Monday and Friday. That's just my schedule. It's easy to remember. Every Monday and Friday after my bath, I make sure my skin's good and dry. And then I'll find a new spot for the new patch. I remove the old patch and throw it out. But here's the patch container itself. And it has an expiry date at the bottom in case you're wondering. And then there's a little like a little rip tear here. You tear it open. And then inside the actual patch, inside the container, I'll just open up the container here. I want to keep this patch for this week, so I don't want to ruin it. But you'll get a little patch that is, as you can see, it's just a little tiny patch. It's like literally the size of my finger. You know, it's like the width of my pinky kind of thing. And it's only about maybe 3/4 of an inch long, or like, I don't know, almost 2 centimeters, I guess, if you're doing from that perspective. So you can see this is this very small patch. And it has like a little split in the middle right here that you have. Basically, it's like a Band-Aid. You just take the, see the way. You just take the cover off here, and then you put one side in like a Band-Aid, you take the other. Make sure that it's nice and flat on your skin, that there's no wrinkles on it, so that the application is even. You use your hand like to just warm it up a little bit against the skin, rub it around a couple times, and then you literally forget about it. The thing with estrogen patches is that you can have a side effect reaction to the sticker or to the adhesive. I'm going to tell you that I react to pretty much every kind of tape that exists in a hospital setting. I have allergic reactions to pretty much everything but the paper tape. And I can tell you that I'm not reacting to this. So if you're really hypersensitive to sticky stuff on your skin, I'm going to bet that 90% of the time, you're not going to react to this. For some reason, it's super hypoallergenic. The other thing I want to mention also, I forgot to mention it earlier in the video, is that I had severe palpitations, like needing treatment with adenosine palpitations. I think I put that in my first video that I talk about on this channel. Essentially, I'll be doing a separate video just on SVT and palpitations and how I manage that, and the use of magnesium in perimenopause and how important it is. So subscribe, because there'll be more to come on that. But for the time being, and I'll make sure at the end of this video that you can click on the original one. But the real push to why I decided I needed to be on HRT was when my benign, lifelong supraventricular tachycardia that I've had, that's benign, I've had it my entire life, suddenly became out of control the week before my period, 2 months in a row. I had all these palpitations, and I went to an irregular rhythm where my heart rate was beating at like 180 beats per minute. And the last time that happened, I couldn't control it, and I actually had to call EMS to come, and I crashed. Like, my blood pressure was 80/68. My peripheral was shutting down. I was going into shock, and they had to give me a medication called adenosine to stop the arrhythmia that I was in, and that was a trip. Not fun. And then once I got through that, I went to the hospital. Once I stabilized, they discharged me. Estrogen helps protect the heart, not just from an inflammatory perspective, but it actually helps settle the rhythm of your heart. It actually keeps your SA node, or your placemaker of the heart, behaving. Whereas progesterone is an arrhythmic burden, meaning it increases the chances of having an arrhythmia. So when your estrogen starts to drop, naturally your progesterone will become a bit higher level in the blood and in your system. And therefore, I was starting to have more palpitations the week before my period when my estrogen levels would tank. So here's the issue with that, is that I was feeling very uncomfortable. I wasn't trusting my body anymore. And I knew that I didn't want to call EMS every time I went into these rhythms. So it was time for me to consider HRT. And I can tell you that since I started estrogen, and in combination with the magnesium, which again, I'm going to do another video on magnesium and the importance of that and the kinds of magnesium you're going to want to consider taking in perimenopause and menopause. But essentially, after having taken this for 3 weeks and including magnesium in my diet, I no longer have had major palpitations. I had one little incident yesterday where I got a little dizzy, but I didn't go into a weird rhythm. It was the first time in a couple months now where I feel stable and I feel like things are starting to kind of chill a little bit on the heart palpitation side of things. I also feel like I'm sleeping better, and that's probably because of the progesterone, but nonetheless, having estrogen on board is starting to help stabilize things for me. I am finding that my pain in my joints is slowly starting to recede. I still have uncomfortable joint pain, but it's nowhere near what it was several months ago. So I'll report on this as I go through these videos over time on this channel, but to let you know that this does have an impact on your body pain. I'm also finding that I have less headaches. I have more energy than I did before. I find I'm not quite as fatigued as I was, and things are starting to settle down, like where the dryness of my skin is starting to settle down a little bit, and I don't have dry eyes like I did either. So it's not a magic solution to all things perimenopause and menopause. Please don't think that this is panacea and that if you go on HRT, it's all good. There are still risks associated with this. I clearly have to make sure that I continue to try to lose weight, that I continue to walk and exercise, that I try to make sure that I reduce my risks from a diabetes perspective or from a heart disease perspective. And I'll take you along that journey as well as I start to take in other modalities like meditative practices and exercise and all that. I'll share that journey with you. So come to the community, be part of this process, come and share your stories in the comments down below. My goal with this channel really is to develop a sense of community that we can all kind of band together and learn from each other and support each other as we go through this, because perimenopause and menopause has been in the closet for so long. Nobody talked about it. All we knew is that you just stopped having your period, you were no longer fertile, and you were just in that age, that time in your life. But nobody could explain to us what that time meant. Everybody just knew your period stopped, but nobody told us that your belly got fatter all of a sudden and the weight started to pile on and your blood pressure goes up and you start getting headaches and you feel like you're dying all the time and you lose your zest for life and all of a sudden your sex drive is out the window. And by the way, on that note, I will probably be thinking about testosterone as well, because my drive is it's okay, but it's not great. I'm feeling like I might need a little supplementation, and if that's the case, I will fill you in on that as well. So this is a pretty long video, but I wanted to share all this information with you so that you can kind of get as much as you can out of it and then make some decisions with your healthcare provider as to where you want to go with this. Again, make sure you subscribe because there'll be a lot more content coming in the days and weeks to come. I'll be sharing my experience as I go through this, and I look forward to hearing from all of you in the comments section around your experience and what you're on and how you're feeling and how better you're getting. Try to inform other people who are come to find this channel and are looking for help and looking for support. I want us all to be a part of that process. So if you just want to leave some really awesome comments down below, please do, and I will try to respond to as many as I can. Remember, I'm not a doctor, so you're not going to get medical advice, and please don't think that any of this is medical advice. I'm just sharing information as I know it, and I'm hoping that this helps you have a more informed conversation with your healthcare provider. Take care, folks. Until next time.